Hey there! If you've been trying to conceive for a while and you're starting to explore your options, you might have come across the term IUI. Today we're breaking down exactly what IUI is, how it works, and why it might be the right next step for you and your partner. IUI stands for Intrauterine Insemination. Unlike IVF, which happens in a lab, IUI is a less invasive fertility treatment where sperm is placed directly into your uterus during your fertile window. It basically gives sperm a head start on their journey, increasing the chances of meeting an egg and resulting in pregnancy. This procedure is often recommended when you've been trying to conceive for 6 to 12 months without success, especially if you're approaching or over 35. So when might a doctor recommend IUI? It's typically suggested for couples dealing with mild male factor infertility like low sperm count or motility issues, unexplained infertility, cervical mucus issues that might prevent sperm from traveling properly, couples using donor sperm, or if you have ovulation disorders that can be treated with medication. Importantly, IUI costs significantly less than IVF, typically between $300 to $1,000 per cycle without insurance, compared to $15,000 plus for IVF. Let's walk through what actually happens during an IUI cycle. First, tracking your ovulation becomes crucial. This is where reliable ovulation tests come in. They help pinpoint your fertility window precisely. Digital tests with clear yes or no results can take the guesswork out of reading test lines. Often your doctor will prescribe fertility medications to stimulate your ovaries to release one or more eggs. You'll be monitored with ultrasounds to track follicle development. When your follicles reach the right size, you might receive a trigger shot to precisely time ovulation. Around 24 to 36 hours after ovulation is triggered, you'll go in for the actual IUI procedure. Your partner will provide a sperm sample which gets washed and prepared in the lab. The actual procedure takes just 5 to 10 minutes. Your doctor inserts a thin catheter through your cervix and places the prepared sperm directly into your uterus. Most women describe it as a feeling similar to a pap smear, perhaps a brief cramp, but generally minimal discomfort. Now for some real talk about success rates. Each IUI cycle gives you about a 5 to 20% chance of pregnancy, depending on your age and specific fertility factors. That's lower than IVF, but remember, it's also much less invasive and expensive. Many couples try 3 to 4 rounds of IUI before considering other options. And here's something important to know. About 90% of couples who succeed with IUI will get pregnant within those first 3 or 4 attempts. Throughout this process, accurate pregnancy tests become your best friend. Look for tests that can detect pregnancy early. Some can give results up to 6 days before your missed period. Before we wrap up, here are 3 key facts that might help you decide if IUI is right for you. IUI success rates vary significantly by age. For women under 35, success rates can be as high as 15 to 20% per cycle, but drop to about 5 to 10% for women over 40. Combining IUI with fertility medications can double your chances of success compared to IUI alone. The procedure itself is quick, usually less than 10 minutes, and recovery is immediate, letting you return to normal activities right away. If you're considering IUI or just starting your fertility journey, talk with your doctor about whether this might be the right approach for you. Drop your questions below, and if you found this helpful, hit subscribe for more fertility guidance. Good luck on your journey.